In speaking to my colleagues all around the country, I'm finding out what their fears are about this. One of their fears are they haven't done it before. We don't inject joints every day in small animal medicine. The equine practitioners are a little more comfortable with this because they do inject joints on the racetrack a lot. It's part of their everyday practice, really. But in small animals, that's not part of our everyday practice. We're not injecting joints a lot. So in these videos, I'm going to show that this process is easier than a spay, a routine spay. We're taking a little bit of fat. In a dog, I like to take it behind the shoulder blade. I don't even have to put a collar on them afterwards. Everybody knows those big lampshades. They don't even have to wear a collar when I'm done. So we only need a tablespoon of fat for this, 5 to 20 grams of fat. That's a tablespoon, 4 teaspoons of fat. That's about a fourth of what we used to have to get when I sent it out to the West Coast. So it's a much quicker procedure, and we're going to get lots more cells, which is neat. It's a very small incision, less than 3 inches. And I take the fat, it takes 10, 15 minutes, and I'm done with the general anesthesia risk. Now all I need is sedation about 2-3 hours later after we process out those stem cells. And then in the video, I'm going to show them how I inject the joints. Just tips, reminders basically, of easy ways to get into the joints. So I want to minimize that, make it easy on the vet, show them where I go. I'm going to go step by step, every joint in the body that we might inject with these stem cells. I'm going to walk you through the hip joint. Fat dog, skinny dog, doesn't matter. I'm going to walk you through the hip joint, the stifle joint or the knee joint, the hock joint, the carpus joint or the wrist joint, the elbow joint, which brings a lot of fear to people, and the shoulder joint. And out of all of those joints, the two that strike the most fear are the elbows and the hips. And they're easy. I can have people doing it without even looking, literally, through anatomy alone and the feel of their hands. They'll be able to get into those joints. Everybody knows how to give an intravenous injection. We put a filter, it's just like giving a blood transfusion, and we filter the stem cells as they go back in so that we don't get any clots, there's no risk. Good thing about these fat cells or these stem cells is that they have low immunogenicity, and what that means is that they're unlikely to create an immune or allergic reaction. I was doing a demonstration out in New Jersey, and one of the veterinarians said to me, "God bless you, Dr. Mike," because that is what I'm worried about. I haven't injected a joint for 5-6 years, and I understand that, and I just will give those reminders. It is a very easy process for a licensed veterinarian. We're already trained to do all of this, and collecting the fat is nothing in consideration of the kinds of surgeries that we do every day. Like I said, it's easier than spaying a dog. It really is.